Good evening. Welcome to This Week in Medicine. It's February 7th, 2022. This is brought to you by the Foxhall Foundation. We have an education mission. We have a book. We have lectures. We're hoping to get ramped up this year as we hopefully leave the global pandemic in our dust. We have a wellness center. Carrie, our nutritionist, is doing an awesome job. She's enjoying her job with us at the Foxhall Foundation, and she is accepting new clients. So please reach out to Carrie. Tala's on an Omicron pause. We're working on new classes for the year at our center. And of course, we have our active master's class and key movement class. And Mr. Ricky tells me it's going very well. So if you want to check in with Mr. Ricky about attending the classes for adults, they are great. And of course, we have kids classes as well. So in the inbox this week, Dr. Thomas's inbox, still questions about Omicron and treatment, but not so much anymore since we haven't seen too much of it. The fourth shot is less effective, so don't worry about getting a booster shot of the traditional mRNA vaccines. We're not doing that right now. Antigen versus PCR test, we'll go over that one more time. There is a new trial of a Moderna Omicron booster. I believe they are enrolling patients to try this Omicron booster in Rockville, Maryland. Another thing I frequently see in the inbox is I can't sleep, especially with the pandemic. We've had more insomnia. Antigen test is still negative. Still seeing that. People are hoping that the antigen test will tell them if they do or don't have Omicron. This week I have a patient who I'm pretty sure has Omicron, and she has tested for the past, 8 days, and every test has been negative. PCR test, antigen test, but really it's probably what she has. So even if your test is still negative, if your symptoms sound suspicious, just quarantine yourself for 10 days. Omicron and elective surgery doesn't look like it's an issue. Everybody's been getting their surgeries without a problem. And should I take vitamin D? We talked about that last week. We'll probably not touch on that again this week. I did get my antigen test kits. I hope you did too. A lot of you sent me emails saying that you did get your antigen test kits. I did see that because they were delivered during the icy snowstorm, and mine were delivered during the icy snowstorm, it's possible that some of these test kits are invalid just because they were out in the snow and the wind and the rain. So we'll see. I haven't had to use my test kits yet, but at least I have them. So those returned. So today we're going to talk about the elephant in the room, especially for the past couple of years, which is insomnia. This guy's asleep, and don't you wish you were too? And that's really the problem. A lot of people have insomnia. In fact, it is not uncommon for all of us at some time in our life to experience episodes of insomnia. And because it's considered a normal variant on life, it's not really considered a medical problem because most insomnia will resolve on its own. So hopefully that will reassure some of you who have sleeping problems that for most people it will go away and you will restore your natural sleep cycle. So it's a classic clinical problem, which means it's not a problem that we find on laboratory testing typically. It's a clinical problem. You need a clinician. You need a primary care doctor typically that you can start talking to. Not really your pharmacist. The pharmacists are great and you can ask for their advice, but typically they're not the best person to talk to about what sleeping pill you should take. Instead, it's better to go back to the basics and talk about this with your doctor who knows you, because typically if you tell your doctor what your sleeping problem is, by knowing your medical history, they may be able to help you figure it out without medication. Sometimes it's sleep initiation. You can't fall asleep. It takes too long to fall asleep. For a lot of people, it's just staying asleep. They can't stay asleep all night. They wake up. Once they wake up, they can't get back to sleep. I have a trick that I have started to suggest to patients with the staying asleep problem, and that is if you do wake up, try not to pull yourself completely out of the sleep cycle. There are many waves, brain waves, that happen while you're sleeping, delta waves, REM sleep waves. Try to get yourself back in. If you wake up in the middle of the night, if it's possible that you can remember a fragment of a dream or a scene or a scenario that was in your mind, as long as it's not a nightmare, try going back to that without getting out of bed, without waking up to go to the bathroom. And see if you refocus on the dream details, you can actually put yourself back into sleep. A lot of people just have painful sleep. They're rolling over on a rotator cuff injury. Their hips hurt, their back hurts. So painful sleep may really be the cause of a lot of people's insomnia and sleep problems. So you certainly could take a Tylenol before going to bed, or make sure that you're addressing a sleep issue like a bed that hurts you or a pillow that's not comfortable. Snoring is a big sleep issue, but that does tend to be something that needs to be assessed with a sleep specialist and a sleep study. Restless leg movements are another sleep disorder that causes insomnia. Sometimes it's a new medical problem, so make sure you talk about that with your doctor. If it's a new medical problem like polymyalgia rheumatica, that's a pain syndrome and a musculoskeletal pain syndrome. New medication could cause a problem with sleep for sure. And also, of course, new psychosocial stress like a global pandemic. Is natural better when it comes to sleep? So there are many research studies on insomnia, and most of them do show that cognitive behavior therapy techniques are more successful than medication. But we don't have enough cognitive behavior therapists to address all the issues we have with insomnia. One way to do this is to tell yourself a preset story. So one therapist recommends that you make up a story that's the same, that you tell yourself every night when you're going to sleep. And that story has details in it that you specify before you go to sleep, like laying out on the beach, you lay out your blanket, you take out your sunscreen, and walk yourself through that story. And if it's the same story every night, it could put you to sleep, just like we put children to sleep with bedtime stories. Sleep diaries also can help because you can analyze what you're doing when you go to sleep and find out if you have some bad sleep hygiene habits, like sitting in your bed with your iPad. A screen in your face right before you go to bed definitely can impair your ability to go to sleep. So get those screens put away. Maybe if you're not a doctor, put your cell phone downstairs to charge and don't put your iPad in bed. Digital sleep monitoring in an Apple Watch, is that really going to be fruitful? Is that really going to help you? There really is no research on this, and we think through potentially over-analysis of your sleep patterns, this might be deleterious to a natural sleep cycle, because we don't really need to monitor with an Apple Watch or another digital device how much sleep we're getting and the quality of our sleep, because that makes it a medical problem that it really isn't. Sleeping should be as natural as breathing and eating. It's a normal body function. So overanalyzing it, especially not in a medical context, but a layperson's context, might actually increase your anxiety about sleep. Again, address the underlying issue. If it's pain, resolve it. Diagnose your medical problem. Maybe you're hyperthyroid. Also, medication side effects like ADD medication, Sudafed, those are stimulants. Even if an ADD medication settles your brain, it's stimulating other parts of your body and may make it so you can't go to sleep. So this entire subject was prompted by a report that came out this week. It's not a research study. This is a report. And it came out in JAMA, and I thought this was interesting. When I tried to draw up the report, there's an embargo on it from JAMA, which is nice. This is a press embargo. Again, this is for the media. The reason that there is a press embargo, meaning that if you're in the media or a layperson and don't have a subscription to JAMA, you cannot bring this article up, because the embargo is intended to let doctors spend a couple of days reading this study first before it's released to the media and to the public. That was very nice of them. So it specifically says the reason that JAMA has an embargo policy is to allow clinicians and doctors to read studies and research before it's released to the public so that we can analyze this for you. That would have been really helpful with the baby aspirin release that came out a couple of months ago. So this is just a report. Actually, when you do pull it up, it's not a research study, it's an article. It analyzed the prevalence of trends in use of melatonin for the past 20 years. Usually, people are using a 5 milligram dose, but in the past 5 to 10 years, there's an increase in the dose to 10 milligrams. So usage has been increasing of melatonin, and the dosage itself has been increasing, and there's not a lot of data about this. So this was an observational report, not a research study, but it got a lot of media attention this week, so let's go into it a little bit more. This is a great article. Honestly, this CNN article about this report is better than the report itself. So if you want to read something very good, very accurate on insomnia and sleep medication and sleep behavior, it's from CNN Health, Sandy Lamont was the author of the report. She does quote from the study that I previously mentioned that was in JAMA, but it's more than that. It's talking more about what's happening to insomnia medications, our use of melatonin, proper behavioral therapies for sleep. It's a very good article, so I recommend you look for it. It was February 1st, 2022. It's a very good read. So first of all, they talk about melatonin. Remember, it's not an herb, so this is not a supplement. You're not taking a plant, so it's not that natural. It's actually a hormone. Its usage is on the rise, and again, we went from 5 milligrams as a society up to 10, and unfortunately, I know patients who take a lot more than 10. There really is no safety data on that at all. The short-term safely is established. The real safety and use for melatonin was to adjust to a new time zone. So if you're going to China, and maybe we will in the next couple of months, we'll have our travel restrictions released. If you're going to a new time zone, the way to take melatonin is to take it 3 hours before you want to go to sleep in your new time zone. So not the time that you're used to in the United States, but if you go to Mexico, if you go to Europe, you want to take it 3 hours prior to desired sleep time in your new time zone. And it's actually very effective at adjusting your sleep cycle in a new time zone. Long-term use, if you're continuously using it, we don't actually have a lot of data. Again, the CNN article mentioned previous research on melatonin content shows that because these are unregulated, these are supplements, these are not FDA-approved drugs, commercially available melatonin supplements could have none of the melatonin in the pill, or up to 500 times, almost 500% of the labeled content. So you really don't necessarily know what you're getting when you're getting a melatonin supplement for sleep. How can we work with this? Well, through this article, you can look up the U.S. Pharmacopeal Convention Dietary Supplement Verification Program. This was something I was not aware of. I probably should be aware of it, but I don't spend a lot of time on supplements in my recommendations for patients. Although I will say I do recommend melatonin. Generally, I feel safer using FDA-approved and researched drugs. So knowing that a lot of our supplements, like melatonin, have not had research, have not had approval process, does make me nervous recommending them to patients. But this U.S. Pharmacopeal Convention Dietary Supplement Verification Program is very interesting, and I recommend that you click through it. They have a section on dietary supplements online, so you can go to the USP and go through this part of their website to find out which of the melatonin supplements bear this USP mark, meaning that they have been reviewed by this independent, scientific, nonprofit organization focused on building the trust and the safety of the safe supply and quality of medicines, which are not covered by FDA. So this is a very interesting website, and I think it's probably something we should be using more because it does discuss what supplements have been tested and bear this USP triangle. Mild cognitive impairment is something that's been in the news a lot lately. It's a term we've been using in medicine probably the past 5 to 10 years. Mild cognitive impairment tends to happen to people over 50. We think it can be a precursor to dementia and Alzheimer's. It also can be a sign of late life depression. It can be a sign that you are on medications that are giving you cognitive impairment. So cognitive impairment is not necessarily a diagnosis in and of itself. It's not a disease, but it does suggest that your brain is not working in some way. And in particular, there's been a lot of media reporting lately about which medications we use for sleep contribute to mild cognitive impairment. And this comes from very well-respected organizations and groups of doctors who study the use of these drugs and what contributes to cognitive impairment. So in particular, the benzodiazepines, we use these drugs in anesthesia. They are intended to give you amnesia. We don't want you remembering your colonoscopy. We don't want you remembering your outpatient surgery. So we want these drugs to make you forget. We don't want these drugs to make you forget if you're using them for sleep. So that's one of the reasons why we don't like to use these as our primary sleeping pills and sleeping medications, because they do cause mild cognitive impairment. So recently you will find that many neurologists, sleep doctors are recommending against these medications in routine use for sleep because they do impair your brain. We use them to sedate. So yes, they're useful for sedating if you want to go to sleep, but the side effect of these drugs long term is to encourage cognitive impairment, which you don't want to do. Another group of drugs besides the benzodiazepines are the sedating antihistamines. Benadryl is the king of the sedating antihistamines. It's also called diphenhydramine. There's another one called doxylamine. Look for these on the labels of the over-the-counter medications. It's the active ingredient in Unisom, Tylenol PM, Advil PM, Simply Sleep, NyQuil. These are all sedating antihistamines, which we also associate with mild cognitive impairment. You should not be using these for sleep. The non-sedating antihistamines that you might want to use for itching or hives are Xyzal, Allegra, and Claritin. They certainly don't help for sleep. So if you're wondering what antihistamine can I take at night if I'm itching, well, these ones are safe and won't impair your cognition. So what medications can we use? Well, we've been using the non-benzodiazepine sedative hypnotics. So what in the world are those? Well, Ambien is everybody's favorite, Zolpidem. There's also Sonata, Imovane, which is a version of, that should be Lunesta, not Luncesta. It's Lunesta. These medications are in their own category. They are not benzodiazepines. We don't have a lot of data on whether or not Ambien causes cognitive impairment, but there's nothing definitive. So right now we cannot say that the literature supports or research supports the idea that mild cognitive impairment comes from Ambien. There is a strong suspicion that Ambien could cause cognitive impairment. So again, if you don't need to take a sleeping pill, don't take one of these, but definitely don't take the previous list either. Don't take these ones. So this list is somewhere in the middle. The drugs that I like to prescribe patients if they need medication, trazodone, which is an old antidepressant. We can start out at half a pill, which is 25 milligrams. You break the 50 milligram in half. And then some patients need as much as 300 milligrams. I don't have that many patients who need that much to go to sleep, but it's not unheard of that patients would need to go to 50 milligrams, 100 milligrams, 150 milligrams until they get a good sleep effect from this medication. We know this is safe. It's been out for 40 years at least, and we do not think it causes cognitive impairment. Nortriptyline is a tricyclic antidepressant. Again, it's an old antidepressant. At higher doses, it's effective as an antidepressant, but that's 50, 75, 100 milligrams. At 10 milligrams, it's helpful for inducing sleep, and it's also used to prevent migraines and to treat nerve pain like peripheral neuropathy. So sometimes we'll start at 10 milligrams of nortriptyline at night for sleep. It's safe and effective at that dose. And then one of my favorites is off-label use gabapentin or Neurontin. This was approved by the FDA as an anti-seizure medication. It doesn't work that great as an anti-seizure medication, but it is a great sleeping pill. It's a great nerve pain pill. And again, we start at 100 milligrams, and you can work your way up, 200 milligrams, 300 milligrams. These medications are all safe to take every night. We don't think they cause cognitive impairment. And the nice thing about their use, especially trazodone and gabapentin Neurontin, is they have a wide dosage range. I have patients who take as much as 800 or 900 milligrams at night of gabapentin to get to sleep, and it works and it's safe. Again, remember that February is Heart Health Month, and we'll have Dr. Yamamoto guest talk in a week or two on Heart Health Month, and in particular, CDC is asking us to pay attention to blood pressure. We talked about that last week. Remember, there are benefits to treating your blood pressure with medication, not just diet and exercise. And the benefits are you get some bonus effects, as I like to think of them. The bonus effect drugs are the ACE inhibitors, the ARBs, the beta blockers. They don't just bring your blood pressure down, they keep your blood vessels young and healthy, and they keep your heart young and healthy. There are many other benefits from taking medication. Not liking pills is just a missed opportunity to defeat age and to defeat cardiovascular aging. You don't want to miss that opportunity. It's real, it works. We've had great advances in cardiovascular disease prevention and treatment over the past 25 to 30 years. We're not leading in Omicron. That's why I saved this slide for the last, because hopefully we won't be talking about this too much anymore. We're still in the waiting mode. So remain vigilant. Don't panic, but I think probably we've rounded the curve. Just to refresh your memory on the practical guide to testing, you can still get these home antigen test kits. They may not immediately be positive, so test yourself maybe 2 to 5 days after you think you had exposure, or even if you're symptomatic, you may not be positive the first day you're symptomatic. And then once you're positive on an antigen test, don't keep testing until maybe if you want to get out of your quarantine, And it's nice and courteous to others to not spread this disease if you have 2 negative antigen tests. 2 on subsequent days probably means you're not contagious. Again, these are the rapid tests. You can get them in the mail. I got mine. You can get them from public libraries. You can get them at the pharmacy. Again, you can use it to diagnose yourself. If you need to know if you're positive or negative and your test is not showing you these antigen tests, you can try to get a PCR test because those are much more sensitive, but don't use them to get out of quarantine because they could be positive for 38 days. I have to say we were successful in getting a couple of our patients Evusheld. This is not for most people. This is for people who have no immune system because they're on immunosuppressant therapy, because they have lymphoma, because they did not have any antibody response to the first 3 injections of their vaccine. So I believe it was last week we had one of the first patients at Sibley get Evusheld and one of the first patients up at Hopkins get Evusheld. And we don't know how well this is going to work. It's an antibody therapy for people who didn't make antibodies. But we have some hope that maybe it'll give these people some protection. So this is being deployed, very limited use, not a lot of data that it's going to be a perfect prophylaxis for patients, but at least it's something in people who had no antibody response. Paxlovid's approved, and I have not used it yet. A 4th shot, not this shot. So again, the 4th shot is really just for this list of people who've had organ transplants, stem cell transplants, advanced or untreated HIV infection, high-dose corticosteroids. So if you're taking 40 to 60 milligrams of steroids a day, that's something to discuss with your doctor. But generally, that's not a large portion of people in our practice. So did we hit the silver lining? If we thought on December 6th that the silver lining was that Omicron was going to get rid of Delta, so far so good. Again, wear your masks. It's still circulating. Our area is very fortunate that we hit our peak early. Tony's tip of the week: your insurance may stipulate a pharmacy that you must use for cost savings. You can pay extra, but the pharmacy insurance programs like Medicare D programs, they want you to use a specific pharmacy. So some people are being told you must use Walgreens, you must use CVS, or you will pay extra. This unfortunately also shuts out the privately run independent pharmacies, which I really like using. I really like being able to talk to a pharmacist that I know is working at one of these pharmacies continuously and not a shift worker. So I do like these independent pharmacies, but especially at the beginning of this year, there were some changes that are making these independent pharmacies unable to provide your medications because they're losing money by providing them. So it's a big problem. Try to support your independent pharmacies when you can, but the trend is towards punishing these pharmacies by not giving them any cost incentive at all to carry your drugs and give them to you, especially if your insurance plan is telling you that you can't use a private pharmacy. One pitch here for capsule pharmacy. I like the concept of capsule pharmacy. It is a centralized pharmacy. You don't go to the pharmacy. It's sort of a warehouse. They must use your cell phone, so you'd have to use your cell phone with capsule pharmacy, and they deliver your prescriptions to you. So there's a central pharmacy. That way they can carry more drugs. They potentially don't run out of medications because they have one pharmacy. And then part of their deal is that they will deliver your medication to you. So far, I think my patients like this. It's a different kind of delivery mechanism for medications. If you're interested, just go online and take a look. But again, you have to use your cell phone to get your refills and initiate your account with Capsule Pharmacy. Mail order may provide benefits you can't get at your local pharmacy. So some people can get some controlled substance prescriptions approved one time for the year with refills, and you can get 90 days on some of these prescriptions that typically are 30 days. So check that out with your insurance. See if you have a mail order pharmacy like Express Scripts, CVS Caremark, Cigna, if they will send you your prescriptions in the mail for a cheaper cost and without so many authorizations from the pharmacy. One final pitch too is Synthroid delivers. The makers of Synthroid have realized that they are being cut out of the market of thyroid hormone medication by insurance companies. Insurance companies want you to take a cheaper generic. They don't want you taking name brand Synthroid. There are reasons to take name brand Synthroid. It's a more stable drug. It's more quality controlled than many generics. So Synthroid, the company, the manufacturer, has made its own pipeline to get your Synthroid through a program called Synthroid Delivers. They will deliver the medication to you, and you have to sign up for this independently. It cuts out the insurance. So if you want to get that done, we've had success with it. It's not expensive. You don't have to deal with the hassle of your insurance telling you that you can't have it, or an expensive copay for your Synthroid through the Synthroid Delivers program. So fast pitch for the week. Remember, your blood pressure is a number. It requires context. A lot of you did a great job with this in the past week or two, talking to me about your blood pressure. Remember your sleep habits and sleeping pills. There's a lot to know here. Try to fix your habits first before you have to go to a pill. It's not too late to get your flu shot. Again, following on a week or two ago, remember your vitamin D needs and status. And if you still want to get COVID tests, you could submit this easy form, covidtest.gov. And keep your pyramid in shape. There's our book. And please subscribe and hit like. If you don't have a Google account, please click on the link in the top right to learn how to make a Google account. And thank you for watching.